Okay, 6:01. Hi, everyone. Thanks for joining. It's Jeff Chong from the Toronto Triathlon Festival. Obviously, this is a momentous week. If I can risk sounding overly dramatic, it will be the first time in 3 years that we'll be getting the band together down at Ontario Place on Sunday for the 9th annual in-person TTF. And there's a lot to celebrate there. And we wanted to kick off the TTF race week with some cool programming. I'll introduce our guests momentarily. Just some quick housekeeping items. For those who have registered for the TTF, you would have received the online race briefing and the athlete guide this week. We encourage you strongly to read it. There's a lot of good information in there, and there's still time to sign up as well. You'll get much more communication from us this week. But for now, I wanted to introduce from Acorn Biolabs, Andre and Drew. I will pass it over to Andre momentarily, and Simon Whitfield, who, as I always joke, doesn't mind me calling him a friend at this point. He's TTF ambassador, obviously Olympic champion, friend to all, but friend to triathlon more generally. Simon, good to see you. Thanks for joining. Any words of wisdom for this TTF race week before we throw it over to Andre?
Oh, it's TTF race week. You said it right. It's get the band back together again. So I hope everybody just enjoys the week and then just enjoys getting back together for a great triathlon in a great city. And yeah, all the best with it. I'm sorry I won't be there this year, but it's gonna live up to it. Toronto Triathlon Festival always does a great job, and I hope everyone's looking forward to it.
Thanks for that. Listen, I won't get overly nostalgic, but it was 10 years ago in 4 days that Simon and I were down at the Weston Harbor Castle for the press conference to sort of announce it. And geez, that seems like a lifetime ago, but that's a conversation for another day. But in any event, what I'm going to do now is put you in the capable hands of Andre from Acorn Biolabs. He'll introduce Dr. Drew Taylor and Simon and a bit of background as to what they'll be talking about. And then I'll come back on the end just to say a couple parting shots, not at the gentleman, but some parting comments. But for now, enjoy the programming and happy TTF race week.
Wonderful. And thanks, Jeff. And thanks, everybody, for making it out in the Monday evening. Thanks to Simon and Drew. So I'm Andre Pape. I'm here with Acorn Biolabs, and we're thrilled to be a sponsor partner of Toronto Triathlon Festival. And to kick off race week, we wanted to engage Simon Whitfield with our CEO and co-founder Drew Taylor. And the reason behind that is Acorn Biolabs is a Toronto-based health tech startup. And what we focus on is the ability to cryogenically preserve adult cells for the opportunity to use regenerative medicine. And regenerative medicine has this immense potential to ultimately heal our bodies using our own cells. And the promise of that is to recover from injury faster, to rejuvenate what we've lost with age, and to even combat some of the most impactful diseases. And with that, there's so many opportunities to preserve the lifestyle we want to live, to do the activities we want to do. And we can see no better activity than the triathlon and the ability to really extend your body's capabilities in such a wonderful sport like that. And we feel absolutely privileged to be talking to Olympic gold medalist, Canadian flag bearer, and joined with him is Acorn CEO Drew Taylor to discuss a little bit about Acorn, a little bit about what it means to be an athlete, and what might be some of the potential of regenerative medicine as it pertains to high performance athletes, as well as the weekend warriors and everybody in between. So I'll pass it off to the capable hands of Drew and Simon, and take the talk from here. Please leave any questions you may have in the Facebook chat, and we'll regroup at the end of this to discuss anything you're curious about.
Awesome.
Tell you what, if Jeff Chung could have projected 10 years ago to now to say that we'd be sitting here with you and talking with Acorn and that to be the idea that would be a partner for Toronto Triathlon, you would see the value in that partnership and to meet our community of triathlon. It's yeah, good job to Jeff and the crew and thanks for having me. And this is really exciting. I'm a lifelong learner, as they say. And we had an initial call, and after I left the call, I was just like, oh, there's this and there's this, and so I've been really looking forward to this call, Dr. Taylor. And so yeah, thanks for coming on and thanks for having me.
No, thank you so much. This is a real honor. Simon, thank you so much for taking time and obviously really enjoyed our catch up earlier, but excited to dive in. I have to ask, like, what is going on in, so I'm a baseball player. We may get into that. So I'm not an athlete. So I want to know what an athlete would be going through right now as they're facing a triathlon in front of them, because I couldn't even imagine it. So what is the preparation coming up right now that these guys and gals will be going through?
I mean, I think my experience all the way through the career, all the way from the first one you do to the manyth one you do, is to get out of your own way that week. You know, as in, it's the temptation is to cram in a little more training. The temptation is to go and find that little secret sauce of nutrition that's going to make a difference, or that little extra stretching session you might do. And the key is to really just hold the course. So I'm here in Lake of the Woods. I did a 222-kilometer ride last Friday. And the question the night before was, you know, how do we carbo load? What do we do? And my thing was like, I don't know much, but what I do know is don't change anything. It's really about holding the course. The work is already done. And if it's not, so be it. There you are. So yeah, the week of should really be about, you know, getting sleep and getting prepared and thinking it through, but also just enjoying the process. It's this thing you signed up to do, you know, and it's this challenge you took on, and it's a great opportunity to test yourself. You get to connect with your community, and yeah, it's the challenge is to just keep those butterflies. Don't try and get rid of butterflies, just make them fly in formation, as my dad used to say, and hold the course. So yeah, but hey, listen, don't be doing the no baseball athlete thing. I played a little baseball as a kid. Hitting a curveball is a whole other ball game. So you know,
well, baseball definitely has its elements, but no, I mean, I'm in awe of what you were able to accomplish, and honestly, any athlete that is going to enter a triathlon and complete it, it's just it's a massive accomplishment to just get through it, and I commend all of those people that are about to do it. It's awesome.
There you go. That's our sport for you.
Yeah, exactly. Every day out there is an accomplishment. That's quite a sport.
Yeah, it becomes a real lifestyle too. You know, it's not just about swimming, biking, running. It becomes about, well, how do I learn about nutrition? How do I learn about sleep hygiene? How am I going to take care of my body in all these different ways? And obviously that might in the nearsighted bit of that is like, oh, it's going to make me better at triathlon, but it's actually just going to make you healthier. Your health trajectory, the trend of your health is going to improve. And so triathlon as a sport, as a community, has been early adopters. They're always interested in understanding new things, understanding where it fits into the big puzzle that they're trying to put together. We love all those little bits and pieces. And so I think that was what was so intriguing about today is the, you know, what is that? The future is here. It's just not evenly distributed was the quote we found last time we chatted. And then that's true that the future is here. And now this ability to Acorn, your towards regenerative medicine is quite interesting. I'm really interested in how that process works. I mean, what is if I'm an athlete, if I'm anybody, if I'm an athlete and I'm like that, I get that. I want to hear more about that. What do I actually do? What happens next?
Yeah, well, I mean, ultimately, like this is going beyond the staples that we need for obviously performing a triathlete or health in general, right? I mean, you have to be getting good sleep, you have to be eating right. I think most triathletes have exercise down pat, but you know, we're living in exciting times where you're able to access some of these next generation kind of healthcare opportunities. And one of the big things that I learned in my career is the power of our own cells. right? We have, these amazing factories inside of ourselves that keep us healthy. But unfortunately, as we get older, they do start to wane and they lack performance. And I saw it firsthand when I was actually working here in Toronto at Mount Sinai Hospital. And I was part of a group, the bioskeletal tissues engineering team. And essentially what we were trying to do is use a patient's own cells to heal themselves. And I was focused on cartilage, right? So this is probably on the minds of some of our athletes, right? As they start to experience some wear and tear. Certainly was on my mind in baseball with chronic injuries, kind of similar to runners in some ways, although, mine was in the upper body. And, as our cartilage starts to wear down, it doesn't grow back very well. And so we were looking at ways of taking cells from a patient and growing that cartilage back for them so that we could actually put that cartilage back in their bodies and give them a lifelong resource. Much better and much more promising than putting in metals or plastics. And so it was an amazing experience for me to go in and take biopsies of patients, right, when they were going in for these surgeries. So arthroplastic surgery to replace those joints, so fake knees, fake hips. And we take those cells back to the lab to see if in practice we could culture out the cells that would be required to resurface that joint with their own cartilage rather than put in that implant. And it came with some challenges. And after, a while, and to save people a lot of really boring reading, it really came down to age, right? So the age of the individual that was coming in directly corresponded to what we were able to do with those cells in the lab. And so most of the patients were seen, and when I say most, I mean pretty much all, were elderly, up in years. They have wear and tear, bone on bone, lack of cartilage, osteoarthritis. And so we're now taking this sample of cells at a patient's worst joint health, and then asking those cells to regrow cartilage for them and perform at their best all over again. And that was a huge, I think, issue with our expectations. And so, we proved out very quickly that if we had access to younger cells, we could actually produce the cartilage that would be required, and healthy cartilage that could be used in these strategies in the future. And that was kind of a sad moment for me, because it was this realization that the vast majority of the population that we want to help would have had to have done something earlier if they wanted to capitalize on these next generation of therapies. And that really is what Acorn is all about. It's the opportunity to very simply, non-invasively, take a sample of your cells now so that you can set those aside for when you're going to need them down the road.
So that has arrived. I mean, I can go.
You can,
I can do.
Yeah.
Two thoughts I had from that. First of all, you must have been a heck of an addition to the Mount Sinai intramural baseball team. They must have loved seeing you come along and have you on the squad.
They wouldn't let me play.
Oh, come on, guys. And just going through that the science of it, understanding it, where it can go wrong, what the challenges might be, not just in terms of taking an aged cell, but what are the complications. But then also just, all of this at the end of the day comes down to the so what. So that sounds great. Can I actually go do that? So that's something I can go do now. I can Acorn it, and I can set myself up for regenerative health in the future.
Yeah, and that's an important step, right? Because what you're talking about is the accessibility, right? The ability to go do something. And so we wanted to make sure that it was going to be accessible, right? And so both like cost-wise is a big consideration, but also, we're talking about taking a sample of your cells. So invasiveness is actually, a huge issue. We're used to hearing about cells, getting extracted from people's bone marrow and different things. But, today it's amazing that we realize that there are these pockets of stem cells that exist in multiple parts of our body. And one of the places where that is most full of adult stem cells is actually our hair follicles. And so what we've done and proven out is that you can extract stem cells, adult stem cells, from your hair follicles. And so in a simple, plucking of hairs from the back of your scalp, you can avoid drilling into the iliac crest and harvesting bone marrow and those things, right? And so it is really a very non-invasive and painless thing.
Wow. Gosh, I mean, the implications for that, for as much as we want to perform this weekend, it really actually is about not limping next weekend. And it's about being able to do this as a 20-year-old, do it again as a 50-year-old, and do it again as, I like that idea of being coached by your 70-year-old self. That's why I ultimately walked away at the end of my career, was I started thinking, oh, I want to play a lot of soccer coming up here, and I'm not sure if my knees really want to keep doing this distance stuff and keep pounding away. My 70-year-old self was kind of whispering in my ear saying, hey, you got a lot of things to want to go do. Are you sure you want to keep pounding away? Now, obviously, there's other things preventative wise that you've got to be doing with, in terms of the basics, the nutrition, the sleep, etc. But the idea that I could store away in the Acorn something for regenerative medicine, that means that in the future I can access that technology as it becomes available and regrow my own cells. That's really exciting. And you're speaking to something else there, is that the word is accessible. This can't just be for people at the absolute in that 1%. It's got to spread out to be available for everyone. What's the mechanism, or how do we accomplish that?
Yeah, well, look, we've seen articles about, an NBA player, an NFL player, or a baseball player that, at the extreme elite level that have accessed, stem cell therapy, or, is receiving injections of PRP, platelet-rich plasma, and some of these new technologies to help us heal our bodies. I've seen a few golfers now that's come out. And so it is becoming accessible, right? I mean, obviously, like it is not widely available at the beginning, but I'm excited to say that these technologies are really becoming widespread. And ultimately, they're all reliant on your own cells. So really, to prepare for it, you can easily find us right online at acorn.me, and we've partnered with a number of groups in Canada, and we'll be announcing some partnerships in the US very quickly. But in Canada today, because a lot of the technologies is in what I would say skincare and sports, right? A lot of the technologies that are here today are covering those areas. We've partnered with a lot of dermatologists and plastic surgeons in the area, and are now working with some sports medicine physicians, and recently, a place that some people in Toronto might know, Totem Life Sciences, a fantastic group that works on high-end athletes. When I had my baseball injury, I ended up getting treated at Totem all the way through to, as Andre said, the Weekend Warriors. We'll be offering Acorn as well, and are offering Acorn. So we're pretty easy to find, which is exciting. It's a new tech, but we've done a good job of putting it into to patients' hands to date.
Oh, that's terrific. It's just amazing to see where this all goes, isn't it? We've seen the evolution in the sports nutrition space, let's call it. We've seen the ability to monitor and qualify the biometrics around performance and around health. And now the idea of being able to use our own cells to regenerate, where I like the idea of avoiding inserting metal and plastics, having to line up in the surgery line and then insert metal and plastics. This is the future. What a fascinating area, not just within sport, but within general health. I mean, our ability to get up and walk around and be forward articulated motion.
Yeah, exactly.
Whatever that might be for you, whether you have limitations to that or not, to be able to get the use of that, that shoulder, that elbow, that knee again. When's the ideal time for people to do this? I mean, you're gonna say now, but I mean, what is their age name?
Yeah, no, that's a big question, right? Because most people that are thinking about these things have started to feel an ache or pain or two, right? And have some effects right here as well. So, I mean, ultimately, the earliest possible chance you can get is the best advice I can give. But we do see like inflection points in our lives by tracking a number of different things in our bodies. And one of the things that we track is the number of adult stem cells. And so we have our peak sometime in our 20s, like after development. We have the most adult stem cells ever. At around 25, or sometimes in our 20s, depending on the individual, that starts to drop. And it's a very, arithmetic line down throughout our lives, decreasing as we go along. But that does pick up pace at 65. And so we've seen an acceleration in the loss of our adult stem cells. And so we do see a lot of people seeking us out that are, in their 40s, 50s, even early 60s, that are starting to think about these things and want to try to get their cells banked before, that aging process picks up pace a little bit. But it's also exciting because this is a very personal decision, and this is essentially a biologic health insurance policy, right? And so a lot of the people that come seek us out end up bringing in their younger family members, their children as well, who are probably, if you're in your 20s, I certainly felt this way. I was invincible at the time and I wasn't thinking about old age. So you're lucky when you've got somebody that's thinking about those things down the line, that 7-year-old coach, right? Self-coach.
Right.
So it's, but again, we have one patient that banked their cells at 83 years old. And his mindset was, look, I'm planning on living to 100, and my cells at 83 are going to be a lot better than they are at 93. So I'll take that decade of no aging on my cells.
Coached by your 100-year-old self. That's
there you go. We got to keep pushing that off, right? That's the goal.
There you go. What are some of the other things that people can do? Well, two thoughts that come out of that. A is we often think about triathlon and endurance events, any sporting event, as about being about results. It's like, where did I place? But one of the things I came out of my career thinking, wow, it's so much more than that. It's actually not about that. That might be this, I don't know, it's a layer to it, but it's ultimately not about that. It's about fulfilling your own potential, understanding and learning more about it. So as an athlete is learning more about it, what are the other ways that they can nudge that 65 inflection to 75? Where's the focus? Where's the best place they can focus?
Yeah. So look, it sounds very simple, but I'm a huge believer in just making sure that you cover your basics and the things that are almost obvious. And the reality is not everybody does, right? People may think that they're eating well, or they may fudge, their answer a little bit, but, having a proper diet, getting exercise, routine exercise, where it's not just about, going out and doing this momentous, thing like running in a triathlon and competing in a triathlon, but making sure that you're staying active and making choices to walk when you can, and just do those things to keep your body moving. Right. One of the biggest indicators of how long you're going to live is actually how fast you walk. Right. So this idea of keeping in motion is huge for me. Obviously diet, and obviously sleep. And sleep is a challenge. I even was challenged with sleep when I was playing professional baseball. Our games are at 7 p.m. at night, right? They're 3 and some hours long. By the time you get out of the game, then you have dinner, then you cool down because, as you well know, you're on a high after competing, right? By the time you finally fall asleep, it's 3 a.m. So my schedule was completely thrown off. So sleep was a big component, I think, of something that I've dealt with and want to try to continue to improve upon in my life. But those staples, it doesn't matter if, you've banked your cells. It doesn't matter if all of those things, you should be taking care of all of those. For the people that really want to take health into their, that next level, and engage with being the best version of themselves that they can be. And I definitely put a lot of triathletes in that category of individuals. There are opportunities like supplements, right, that you can take, right, that are known to be things that, diminish as we age, and things that we can supplement our bodies with. I think that probably the most logical thing in my mind that we should do is try to capture our health and youth as much as possible. And so I can't think of anything that's more obvious than banking our cells at the youngest possible time point we have, to make sure that that time is always available to us in the future. So those next kind of level thinking around healthcare is absolutely part of the package. But I often just go back to staples and say, okay, are you doing all of these things? Great. Let me talk about some other stuff.
Yeah, I like that a lot. And I think, again, it's at the end of the day, sleep. If you can figure out that routine, that self-regulation, to get up in the morning, get outside, get some unfiltered light in your eyes, walk around the block or move around the block, whatever that may look like for you. And doing the same in the evening, to get outside, get some evening sunlight in your eyes, and indicate to yourself, your internal rhythms that, hey, it's time to get up and it's time to go to bed. When I do that, my day is much more productive. And when I don't do it, and there are times I definitely miss that rhythm, then once I'm out of rhythm, I pay the price. So yeah, that's great. I like to hear that. It's these things are there are the extra things that you can do, and there's opportunities to take advantage of and have access to. But let's take care of those nutrition and sleep and those things. I have all these questions for you, but I feel like I'm hogging it.
No.
Andre, on the live stream, they're sitting there going like, "Oh, get this Simon guy to shut up." So, are there any questions to come from the audience, or do I just keep asking?
Yeah, I mean, we've got one question just on the expense, and you know, where Acorn is if you're lucky enough to be in Toronto and in certain parts of Canada, we are available. And so we have our cell collections done through partners. So as Drew mentioned, clinics in and around the GTA are offering Acorn, and so there's a collection fee. It's generally under $1,000. It's in the hundreds of dollars. Different clinics have different fees depending on their appointments. And then after that, we have a recurring fee. And with the recurring fee, as Drew likes to say, is if you can afford Netflix and you can afford Stranger Things, you can afford Acorn. So we're at an affordable fee to store your cells, and hopefully that answers the question that came in through Facebook there.
Great, there you go. Oh, Jeff's
Jeff.
back.
I have a question. Well, actually, listen, first I'll say one of the things I admire most about Simon, or that I like about Simon, is his calming voice around difficult subject matter, if you will. And Dr. Taylor, I could say the same thing for you as well. Is certainly it's race week, so I was listening, but doing some work on my phone as I was, fading to black there. But what's probably an intimidating subject for some, whenever there's asymmetry of information, I think you really did a great job of helping people understand it. And Simon, you asked some great questions. I have a question for you, Dr. Taylor. I learn through examples, and I know I'm a big sports guy. Whether it's baseball and rotator cuff, specifically when you said PRP in golfers, I think of Tiger Woods, and this is going back, a number of years where it was probably even more at the vanguard. I don't know, maybe I'm off by that as well, but explain maybe not what he specifically, but what would that have been? Is that actually cell cryopreservation? Is it a subset of it? That's kind of my question.
Yeah.
To bring in an example.
Yeah. So it was a number of years ago that Tiger came out with this, and it's a story for another day, but I actually got to talk to Tiger about it, which was quite a joy. But he went under what we would kind of consider that like standard PRP, where we take blood into a vial and we spin it in a centrifuge to separate out the plasma and the red blood cells. Right. And so the red blood cells are discarded, and what we're left with is this platelet-rich plasma that is high in concentration of growth factors. And so then this can then be injected back into a site of injury. And there's about 6 growth factors that we target, right, to be present in this growth factor-rich serum. And it can help you to not only heal, but to attract more cells from your body to go to that healing area and really give you some benefit. PRP is, I think, a fantastic addition. And I was lucky to be working in regenerative medicine when PRP was really first coming to fruition. And it really is like intro regenerative medicine. And it has done a tremendous amount of benefit to keep, athletes performing, to heal faster, return to sport faster. It's used pervasively, in skincare and aesthetics, and, people in Hollywood know well about it, and its abilities for skin as well. So it's fantastic. But I think that what we're really excited about at Acorn is that next generation of things like PRP. And so what we've done is actually take the cells that we harvest and culture them, right? Like grow them in the lab. And those cells will release a lot of beneficial things, right, into the media. And that can be harvested and used in the same way that we use PRP, except it has higher concentrations of these growth factors, and actually the building blocks of our musculoskeletal system and skin tissue as well. So it's rich in things like type 1 and type 3 collagen, hyaluronic acid, aggrecan, and a number of these building block elements that we need for healthy tendons, ligaments, musculature, skin, right? All of these things that really constitute connective tissues in our bodies. And so it is an amazing opportunity to think about the next generation of PRP. They can either be used in combination with PRP or on its own, where we're actually leveraging your own cells and the things that they're very good at producing and being able to culture those out, produce those things in abundance, and then give them back to you in that site of injury where you need that healing the most. So that's that's what's coming.
Yeah, it's very fascinating. And listen, it sounds like we could talk forever here, but being mindful of the time, Andre, unless there's other questions, I might just take the opportunity to thank everyone for not only joining us tonight to listen to these fine gentlemen talk about some interesting topics. And Simon, as always, good to see you. Thanks for making time. And Dr. Taylor, great to meet. Andre, thanks for facilitating this. Like we said, it's TTF Race Week. This is very much relevant programming that we're bringing forth to you. And Andre, maybe to close it out, just tell TTF athletes that they'll be able to see you, engage with you, ask questions on a more personal, at least in-person basis with you over the weekend at the Expo and the Finish Line Festival. But I'll leave it to you to finish off, Andre, or if Drew or Simon, you want to say anything as well to part, I will just say thank you and hand it over to you, Andre.
Fantastic. Thank you, Jeff. And thanks everybody for taking the time to do this with us. We will be at the Toronto Triathlon Festival this weekend. You can find us at the Expo all day Saturday. We'd be thrilled to talk to you some more on sports medicine, cell banking, cryopreservation, stem cells, the whole bit. We're really, really excited to be a part of the festival, and we will be there on race day as well. So come see us. We'll have some snacks and refreshments, and hopefully can chat with a few guests and runners and cyclists and everybody that's going to be at the festival. So come say hi. And lastly, we are absolutely interested in chatting with anybody that wants to know about cell banking. Visit our website at www.acorn.me, and we have a sign up form to let us know you're interested in Acorn, you'd like to learn more about it, and we would be thrilled to be in touch with everybody here. So,
Andre, I signed up 2 days ago, and so I'm in there. And you know the way to a triathlete. You said the right thing, where it's food and beverages. Like, yeah, Acorn and all. You're like, pass it over. So yeah, and thanks again for having me. And Jeff, I'm sorry I can't come and be there, but I look forward to sharing that bottle of Chateau de Chateau that's in the background. We'll connect first.
Good eyes. Good eyes. Jeff, thank you so much for the opportunity. Simon, what a pleasure. Not every day you get to be on a call with a Canadian icon. So thank you so much for this. This was such an honor. Jeff, good luck to everything. I'm rooting for every single runner, cyclist, swimmer, everybody. Hopefully everybody gets through it and meets their goal. Perfect. Thank you. On that note, we will say happy TTF Race Week. We'll see you on the weekend, and thanks to Drew, Simon, and Andre. Take care, everyone.
Everybody.
Bye, everyone.
Yeah.